This is The Week in Addiction Medicine, a podcast resource of timely news and top stories brought to you by the American Society of Addiction Medicine, ASAM.
Today is Tuesday, September 16th, and I'm Zach Caruso. Our lead story this week is from Science Advances and is titled Machine Learning and Multilayer Molecular Network-Assisted Screening Hunts Fentanyl Compounds. Fentanyl and its analogs are a global concern, making their accurate identification essential for public health. This article introduces Fentanyl-Hunter, a screening platform that uses a machine learning classifier and multilayer molecular network that covers more than 87% of known fentanyls to select and annotate fentanyl compounds using mass spectrometry, or MS. Fentanyl-Hunter identified fentanyl members in biological and environmental samples. During biotransformation, 35 metabolites from 4 widely consumed fentanyl derivatives were identified. Norfentanyl was the major fentanyl compound in wastewater. Retrospective screening of these biomarkers across more than 605,000 MS files in public datasets revealed fentanyl, sufentanil, norfentanyl, or remifentanil acid in more than 250 samples from 8 major countries, indicating the potential widespread presence of fentanyl. Next is an article in Neonatal Network titled Higher Incidence of Moderate and Severe Congenital Heart Disease in Patients with Neonatal Abstinence Syndrome. Opioid receptors develop in the fetal brain, heart, gut, and kidneys between 10 and 20 weeks of gestation. There has been evidence of an association between prenatal opioid exposure and congenital heart disease, or CHD. This study used results from a clinical database for 26,000 newborns with neonatal abstinence syndrome, or NAS, and found 2.3% had moderate or severe CHD. For neonates without NAS, the incidence of moderate or severe CHD was 1.1%. The types of CHD were atrioventricular septal defect, aortic coarctation/hypoplastic arch, double inlet left ventricle, pulmonary valve stenosis, and pulmonary artery stenosis. The database did not allow accounting for confounding variables such as exposure to other substances. Next is a study in JAMA Network Open titled Initiation and Dose of Methadone Monotherapy versus Combination Therapy, 2015 to 2023. Ontario, Canada has recognized that increased opioid potency has resulted in increased tolerance. In 2020, Ontario changed recommendations for methadone initiation to include increased methadone dosing and addition of slow-release oral morphine, or SROM. This study reported methadone dosing patterns between 2015 and 2023 for 73,000 methadone initiation episodes. Prior to 2018, methadone was usually initiated as monotherapy and at doses less than 30 milligrams. After 2018, an increase in initiation at 30 to 40 milligrams was observed. After the new recommendations in 2020, an increased combination therapy with SROM was observed. However, for those still receiving methadone monotherapy after 2020, 46% received no dose increase in the first 2 weeks. Although increased methadone dose and combination with SROM was reported, the limited uptake of rapid dose titration represents a missed opportunity. Our next article is in JSAT and is titled Retention Rates and Cost Effectiveness of Telehealth versus In-Person Buprenorphine Treatment for Opioid Use Disorder. Researchers used retrospective cohort design reviewing patient records to evaluate telehealth versus in-person OUD treatment with buprenorphine. Researchers did not find that the retention in the telehealth group was lower, but was not statistically significant. The authors did note males were much less likely to remain in treatment overall. In economic evaluation, they found an incremental cost of $3,700 for every 1% increase in retention achieved by in-person treatment. Authors advised that telehealth is a cost-effective alternative to in-person treatment, but additional research should evaluate long-term outcomes and the differences in retention found between males and females. Next is a study in alcohol clinical and experimental research titled Does Paternal Alcohol Consumption Affect the Severity of Traits of Fetal Alcohol Spectrum Disorders? This is a case control study of fetal alcohol spectrum disorders, or FASD, among first-grade students to explore traits of fathers of children with FASD as compared to controls. Data originated from 5 independent population-based cross-sectional studies of FASD in South Africa and included 439 children with FASD, 317 children with partial FAS, 169 children with alcohol-related neurodevelopmental disorder, and 687 randomly selected children without any of these diagnoses. The study found that more fathers of children with FASD drank during pregnancy than fathers of control subjects and generally consumed more drinks per occasion and drank more frequently. After controlling for maternal average drinks per day and maternal tobacco use, there was a significant negative association between paternal heavy/binge drinking and child outcomes, including reduction in child height, head circumference, and verbal IQ. Paternal drinking patterns alone were not associated with a higher likelihood of FASD diagnosis. However, combined maternal and paternal drinking was associated with the most severe FASD outcomes. Our next article is in PLOS ONE and is titled Exploring the Addictive Processes in Repetitive Self-Harm Through a Grounded Theory Approach. It always felt like a choice until it didn't. This study explores to what extent can repetitive self-harm be conceptualized as an addictive behavior. It employed the principles of constructivist grounded theory to guide the collection and analysis of data from 15 adults with current or past experience of repetitive self-harm. 13 categories were identified within the data that depicted participants' journeys with self-harm over time. The study provides a conceptual model of processes that maintain engagement in repetitive self-harm, discussed in relation to addiction literature. Clinical practice could consider working alongside patients to identify where they feel they are within the self-harm cycle in relation to changing their self-harm behaviors. Next is an article in Addiction titled Efficacy of a Personalized Alcohol Approach Bias Modification Smartphone App in People Accessing Outpatient Alcohol Use Disorder Treatment, a randomized controlled trial. Approach bias modification, or APBM, is an intervention in which patients avoid alcohol-related images, often in a video game-like setting using a joystick, and has been shown to be effective to reduce post-treatment relapse in residential AUD treatment. In a randomized controlled trial, researchers evaluated a smartphone app-based ABPM intervention among patients receiving outpatient AUD treatment. Across multiple outcomes, including standard drinks consumed during 4-week intervention, past week drinking days, and heavy drinking days at 8 and 16-week follow-ups, they did not find significant difference between intervention and control groups. The only difference noted was past week standard drinks consumed at 16-week follow-up. Our final article is in Addiction Practice and Clinical Science and is titled There's a Lot of People Who Love Them, So Why Call Them Junkies? Clinician and Patient Perspectives About Words Used to Describe People Who Use Drugs. This is a qualitative study that completed structured in-person interviews to explore stigmatizing language in the care of people who use drugs in Boston. 34 people, including both clinicians and people who use drugs, were interviewed to evaluate perceptions of person-first language. The consolidated framework for implementation research was used to frame interview questions, with person-first language being the evidence-based intervention. Participants all agreed that language matters and emphasized the negative impact of stigmatizing language. People who use drugs strongly preferred non-stigmatizing language. However, clinicians expressed more challenges with adopting person-first language consistently. Some clinicians struggle with person-first language due to a lack of familiarity and training, the wordiness of some phrases, and difficulty changing learned semantic patterns. Participants highlighted that the actions of providers made a strong impact, as well as the words used, and patients easily pick up on negative attitudes. This concludes today's episode of This Week in Addiction Medicine. Remember to subscribe to the ASAM Weekly for more exclusive content and our editor's commentary delivered every Tuesday. Be sure to check us out on social media and at asam.org. Thanks for listening. We'll be back next week.